had an early exposure to health care. Culturally, when, as children, you're sent to the family islands every summer once school closes. And I stayed in Cat Island, one of the remote islands, with my aunt, who was a public health nurse. In fact, she was the only health provider on the island, and I had that exposure. And I made the decision to go to medical school. At that time, it was not many females were going to medical school, but I'm a risk taker, so I went. I got a scholarship. I did well in my exams, and there was the opportunity to go, so I said, I'll do it. And then Georgetown University had a clinic here in the Bahamas, and I was exposed to that, and I was invited to go to their pediatric program. In addition to that, I had family members who were in Washington and who thought that I should go to Howard University. So I was offered a contract before I left the island, actually, to do pediatric residency. And when I was finishing my residency, I was offered a faculty position at Howard. And I took it, and by that time I was married with a child, and my husband was also at Howard. And so I took the opportunity to work as a faculty member and rose in the ranks and actually achieved tenure status. In the meantime, I always wanted to come home to work. And I worked with developmentally challenged individuals and saw what could happen when you don't engage in preventative medicine. And I started public health at Hopkins, and I came home to do the sabbatical. I was invited, because of the work, I was invited. When the chief medical officer's position became available, I was invited to return as CMO.
Well, I met Dr. Dahl Regis firstly she was a student, and we crossed in medical school. She was several years behind me, but I remember her having come from the same high school as I did. And I encountered again, we met again when I was appointed Minister of Health.
And 1 year into that experience with Dr. Knowles, I looked at the congenital rubella syndrome cases that were occurring in the Bahamas. And we were getting ready to do a mass campaign, a supplemental campaign. And so given the epidemiological training I had at Hopkins, I looked through the regional records and saw that there were some countries in the region, like Barbados, that were immunizing women in the reproductive years. And then I went to their records, and they were having congenital rubella syndrome. And as you put the linkages together, you realize that the men were the reservoirs for the virus as well. So we decided that if we're going to truly impact immunization and prevent CRS, they supported the implementation of the campaign that involved immunizing men and women and children.
I first met Dr. Dahl Regis in person in 1997 when she returned to the Bahamas as the Chief Medical Officer of Health. And of course, in her very concerned way, she developed a very special program, maternal and child health program, from which emerged the Adolescent health program.
In terms of infant mortality reduction, it took a while, it took years, but we were able to reduce the infant mortality rate in half during a period of 5 years.
We were transiting or at least developing a community health community health service. And so together we worked with developing a clinic in the South Beach. It's called our South Beach Clinic, which really was a clinic that provided services to children, for example, ear testing, hearing testing, and also vision testing.
Well, definitely she would have, her achievements relate to the fact that she would have received the PAHO Administration Award a few years ago. If you've ever seen Dr. Dahl Regis function in an international or regional setting, you immediately know that she has gained the respect of many, and many people actually covered her wisdom and her opinion. And I think that speaks volumes to how she has been able to elevate the conversation around health, but also elevate the Bahamas in her conversations around health, both on the national, regional, and international stage.
I served on as a member of the WHO Executive Committee. Dr. Margaret Chan, who was the director of WHO, said to me, well, I read all the papers and participated fully in the event, and they found me rather challenging, I guess. She said to me, you take on the big boys, don't you? And I said, why not? You know, so the beauty of WHO is one country, one vote, and you have regional representation that's rotating. So it provides opportunity for people who come from a small island community, only 300,000, to work with the Brazilians, to work with the Africans, the Emeralds, and all the other group. PAHO was a very good experience. The Bahamas had the opportunity to be on the executive committee of PAHO. I learned a lot from that experience on the committee and working with the program, the subcommittee on program and planning. To the director of PAHO and the director general of WHO, this is your legacy. To the ministers of health assembled here today, your colleagues, your children, your grandchildren, and generations to come will be able to see you in that photograph on this day when we have declared the Americas free of endemic measles transmission. Thank you. It was difficult to achieve elimination of measles, rubella, and congenital rubella. There were challenges for measles elimination. We recognized that there would always be importation of measles. However, if you have a certain level of herd immunity, you would interrupt endemic transmission of measles.
The work that she has done in terms of ensuring that the CMO's report was there, ensuring there was a reduction in the mother-to-child transmission from the HIV and the AIDS program. Significant. The kind of work that was carried on ensured that we now have an accredited research lab dedicated to that work here in the Bahamas.
It gives me great pleasure. I feel prideful in standing here this evening, recognizing the good work that the countries have done, the accomplishment we have made as a sub-region, as a region, and in the world. We have done it. We knew we could do it. 7 Caribbean countries have achieved, of the 11 countries of the world, 7 are from the Caribbean. I am not only proud of the achievement, but the capacity building that resulted as countries embarked on the initiative.
Dr. Dahl Regis is deserving of this award because she exemplifies, I think, a lot of the characteristics of a leader. She's inspiring, she's encouraging, she has integrity, she has courage. But I think beyond that, she is extraordinarily humble, and she sees the humanity in others. Maya Angelou once said that a leader sees the greatness in somebody else, and if he or she cannot identify that greatness, if he or she only sees himself or herself, then they're not a leader. And I think above all, she's deserving of this because she sees greatness in other people and not just in herself.
This recognition of the work that I've done in public health does not belong to me alone. I could not have achieved the work that I've done without the contributions of so many, particularly the health workers in the field, the staff at all levels, my family, particularly my late husband, my children, my immediate family, very good friends, and lots of prayers, faith and prayers. Could not have achieved this recognition. And I am truly grateful for being recognized as a PAHO public health hero. That's all I can say.